Welcome to Nursing MANTHRA Academy. Today we are going to discuss regarding colostomy care questions. The next day, the nurse will assess patient's stoma. The nurse noticed that a prolapsed stoma is evident if she sees which of the following? Options: A. Sunken and hidden stoma. B. A dusky and bluish stoma. C. A narrow and flattened stoma. D. Protruding stoma with swollen appearance. Answer D. Protruding stoma with swollen appearance. A refers to a retracted stoma, B refers to a stoma that is getting a very poor blood supply, and C option is a description of a stenosis of the stoma. So the answer is D. Protruding stoma with a swollen appearance. Next question. Patient asked the nurse what food will help lessen the odor of his colostomy. The nurse's best response would be. What is the best response of the nurse to the patient? Options: A. Eat egg, eat cucumber. C. Eat beet greens and parsley. D. Eat broccoli and spinach. So which one will cause this? Yes. And the answers: eat beans, beet greens and parsley. SHINCY and PROMETRIC helps lessen the odor of the colostomy. Spinach, broccoli, cabbage, cucumber, like petrolo, bottle gourd also help lessen the odor but are gas formers. Eggs are not recommended because they are known to cause unpleasant odors in patients with colostomy. So eat beet greens and parsley is the correct answer for this question. If you didn't subscribe the Nursing MANTHRA YouTube channel until now, please subscribe to get and press the bell icon to get the updated videos. Next question. When observing an osteomate do a return demonstration of the colostomy irrigation, the nurse notes he needs more teaching if he if the while giving the health education, extra health education is required like that. Options: A. Stops the flow of fluid when he feels uncomfortable. B. Lubricates the tip of the catheter before inserting it into the stoma. C. Hangs the bag on a cloth hook on the bathroom door during fluid insertion. And D. Discontinues the insertion of fluid after only 500 ml of fluid has been instilled. These are the options. Answer C. Hangs the bag on a cloth hook on the bathroom door during fluid insertion. The irrigation bag should be hung 12 to 18 inches above the level of the stoma. A cloth hook is too high, which can create increased pressure and sudden intestinal distension and cause abdominal discomfort to the patient. So we have to hang the bag on a cloth hook on the bathroom door during fluid insertion. That is the answer. Next question. A client is scheduled to undergo an abdominal perineal resection with a permanent colostomy. Which of the following measures would be an anticipated part of the client's pre-operative care? So, what is the pre-operative care measures we have to follow for this client? Options: A. Keep the client NPO, nothing by mouth, for 24 hours before surgery. B. Administer neomycin sulfate in the evening before surgery. C. Inform the client the total parenteral nutrition will likely be implemented after the surgery. D. Advise the client to limit physical activity. Answer B. Administer neomycin sulfate the evening before surgery. Antibiotic administration. Question. A client with colostomy refuses to allow his wife to see the incision or stoma and ignores most of his dietary instructions. The nurse, on assessing this data, can assume that the client is experiencing. So, a colostomy patient, if he ignores the wife to see his incision, stoma, and most of the dietary instruction he is not following. Options are A. A reaction formation to his recent altered body image. B. A difficult time accepting the reality and is in a state of denial. C. Impotency due to the surgery and needs sexual counseling. D. Suicide thoughts and should be seen by a psychiatrist. Answer is B. A difficult time accepting reality and is in a state of denial. As long as no one else confirms the presence of stoma and the client does not need to adhere to a prescribed regimen, the client's denial is supported. Sometimes this question also can be asked like body disturbance image also. That option also we can consider, but here the patient is denying. That's why we are selecting difficult time accepting reality and is in a state of denial. Next question. The nurse should insert the colostomy tube for irrigation at approximately colostomy tube irrigation. What is this? How much inches we have? Two options: 1 to 2 inch, B 3 to 4 inch, C 6 to 8 inch, D 12 to 18 inches. Answer is 3 to 4 inches. Remember 3 to 4 inches. They are both used in the rectal tube and colostomy irrigation tube insertion 3 to 4. 1 to 2 inches is too short and may spill out the irrigant out of the stoma. Starting from 6 inches, it would be too long already and may perforate the bowel also. So, the answer is 3 to 4 inches. Even for this rectal tube insertion also, it is 3 to 4 inches. Colostomy irrigation and rectal tube insertion, it is 3 to 4 inches is the height, length of the tube. Next question, situation. A male patient diagnosed with the colon cancer was newly put in colostomy. Shows the best adaptation with the new colostomy if he shows which of the following? Options: A. Look at the ostomy site. B. Participate with the nurse in his daily ostomy care. C. Ask for leaflets and contact numbers of ostomy support groups. D. Talk about his ostomy openly to the nurse and friends. Answer B. Participate with the nurse in his daily ostomy care. Actual participation conveys positive acceptance and adjustment to the altered body image. Although looking at the ostomy site also conveys acceptance and adjustment, participating with the nurse to his daily ostomy care is the best adaptation a client can make during the first few days after colostomy creation. So, participate with the nurse in his daily ostomy care indicate that the client is accepting. and adjusting to the current situation. That is the best adaptation. If you need the study materials, MANTHRA study materials, you can contact me in WhatsApp. Question. Tony, a 45-year-old artist, has recently had an abdominoperineal resection and colostomy. Mr. Tony accuses the nurse of being uncomfortable during a dressing change because his wounds look terrible. The nurse recognizes that the client is using the defense mechanism known as. Which defense mechanism the client is using? So here the Tony is saying like wound looks terrible and he feels uncomfortable. Options: reaction formation A, B is sublimation, C is intellectualization, D is projection. Answer is D, projection. Projection is the attribution of unacceptable feelings and emotions to others, which may indicate the patient's non-acceptance of his condition. So, the correct option is D, projection. Before discharge, the nurse scheduled the client who had colostomy for colorectal cancer for discharge instruction about resuming activities. The nurse should plan to help the client understand that. So, discharge instructions. What is the discharge instruction? We have to give to the patient. Options are A. After the surgery, changes in activities must be made to accommodate for the physiological changes caused by the operation. B. Most sports activities except for swimming can be resumed based on the client's overall physical condition. C. With counseling and medical guidance, a near normal lifestyle, including complete sexual functions, is possible. D. Activities of daily living should be resumed as quickly as possible to avoid depression and further dependency. So these are the options here. During the exam, you have to read the options thoroughly. 2 times you can read the options, and after that only you can finalize the answer. Answer C. With counseling and medical guidance, a near normal lifestyle, including complete sexual functions, is possible. Rationale is there are few physical restraints on activity post-operatively, but the client may have emotional problems resulting from the body image changes. So the answer is C. Next question. The client who had transverse colostomy asked the nurse about the possible effect of the surgery on future sexual relationship. What would be the best nursing response? Options are A. The surgery will temporarily decrease the client's sexual impulses. B. Sexual relationship must be curtailed for several weeks. The partner should be told about the surgery before any sexual activity. D. The client will be able to resume normal sexual relationship. Answer D. The client will be able to resume normal sexual relationship. Surgery on the bowel has no direct anatomic or physiological effect on sexual performance. However, the nurse should encourage verbalization. So the answer is D. Question. The nurse plans to teach patient about colostomy irrigation. As the nurse prepares the materials needed, which of the following item indicate that the nurse needs further instruction? Options: A. Plain normal saline, KY jelly, tap water, irrigation sleeve. So A is plain normal saline, B is KY jelly, C is tap water, and D is irrigation sleeve. So the answer is plain normal saline. The colon is not sterile nor the stomach. Tap water is used in enema irrigation and not in this procedure, although some clients would prefer a distilled mineral or filtered water. And normal saline is not always necessary. KY jelly is used as the lubricant for the irrigation tube and is inserted 3 to 4 inches into the colostomy point towards the right. Irrigation sleeve is used to direct the flow of the irrigated solution out of the stomach and into the bedpan or toilet. So the answer is plain NSS or a normal saline. Next question. A 58-year-old male client tells the office nurse that his wife does not let him changes his colostomy by himself. Which response by the nurse indicate as understanding of the situation? Options: your wife's need to help you is a reality you should accept. Do you think your wife might benefit from counseling? You feel you need privacy and when changing your colostomy. D is, have you discussed your situation with your wife? Answer is C. You feel you need privacy when changing your colostomy. MANTHRA study materials. It includes the PROMETRIC questions from the different authorities and it is having DHA, MOH, HAAD and PROMETRICs in different Gulf countries. And it includes the picture book and there will be a mock test also. To know more details about that, you can contact the WhatsApp number which is mentioned here. Questions. Which of the following is true in colostomy feeding? Options. Hold the syringe 18 inches above the stoma and administer the feeding slowly. B. Pour 30 ml of water before and after feeding administration. C. Insert the ostomy feeding tube 1 inch towards the stoma. D. A pink stoma means that circulation towards the stoma is all well. These are the options. Answer B. Pour 30 ml of water before and after feeding administration. A client is scheduled to have a descending colostomy. He is very anxious and has many questions regarding the surgical procedure, care of stoma and lifestyle changes. It would be most appropriate for the nurse to make a referral to which member of the healthcare team. So, client is posted for descending colostomy. So, patient is very anxious and has many questions regarding the surgical procedure and what is the care of the stoma, lifestyle changes. So, it would be most appropriate for the nurse to make a referral to which member of the healthcare team. Options: A. Social worker, B. Registered dietitian, C. Occupational therapist, D. Enterostomal nurse therapist. Answer is D. Enterostomal nurse therapist. An enterostomal nurse therapist is a registered nurse who has received advanced education in the accredited program to take care of the clients with stoma. The enterostomal nurse therapist can assist with the selection of an appropriate stoma site, teach about stoma care, and provide the emotional support. So the answer is enterostomal nurse therapist or stoma care nurse, any options like that. Even discharge nurse also can be if there is no stoma option is there. Question: a male client with bladder cancer has had the bladder removed and ileal conduit created for urine diversion. While changing this client's pouch, the nurse observes that the area around the stoma is red, weeping and painful. What should the nurse Katrina conclude in this case? Options: A. The skin was not lubricated before the pouch was applied, and the B. The pouch faceplate does not fit the stoma, and C. A skin barrier was applied properly, D. Stoma dilation was not performed. Answer is B. The pouch faceplate does not fit the stoma. If the pouch faceplate does not fit the stoma properly, the skin around the stoma will be exposed to continuous urine flow from the stoma, causing the excoriation and red, weeping and painful skin. A lubricant should not be used because it would prevent the pouch from adhering to the skin. When properly applied, a skin barrier prevents the skin excoriation. Stoma dilation is not performed with an ileal conduit, although it may be done with a colostomy if ordered. So the answer is the pouch faceplate does not fit the stoma. That indicates this redness and weeping and painful area, excoriation and all. So regarding more colostomy notes, okay, you can go back to my video regarding the colostomy care. So detailed description given about the colostomy care. Next question: when doing colostomy irrigation at home, a client with colostomy should be instructed to report to his physician. So if what symptom he is having, he has to report to the physician. Options are A. Abdominal cramps during fluid inflow, B. Difficulty in inserting the irrigating tube, C. Passage of flatus during expulsion of the feces, and D. Inability to complete the procedure in half an hour. So which one he has to report to the physician. Answer B. Difficulty in inserting the irrigating tube. Difficulty of inserting the irrigating tube indicate stenosis of the stoma and should be reported to the physician. Abdominal cramps and passage of flatus can be expected during colostomy irrigation. The procedure may take longer than half an hour. So, if the client feels any difficulty in inserting the irrigating tube, they have to inform to the physician, because it indicates the stoma stenosis. The nurse has to teach them like that. So if you need the Nursing Mantra study materials, you can contact me in WhatsApp, and for the registration and licensing services for all the authorities, data flow verification, license renewal, license transfer from one authority to another authority, all the procedures, if you need any assistance, you can contact me through my WhatsApp. Question. The first day after surgery, the nurse finds no measurable fecal drainage from a patient's colostomy stoma. What is the most appropriate nursing intervention? Options. A. Call the doctor immediately. B. Obtain an order to irrigate the stoma. C. Place the patient on bed rest and call the doctor. D. Continue the current plan of care. Answer D. Continue the current plan of care. The colostomy may not function for 2 days or more, 48 to 72 hours after the surgery. Therefore, the normal plan of care can be followed. Since no fecal drainage is expected for 48 to 72 hours after a colostomy, only mucus and serosanguineous contents will be there. So, the doctor does not have to be notified, and the stoma should not be irrigated at this time. So, normal functioning of the colostomy stoma, it will take more than 2 days, 48 to 72 hours after the surgery. So, until that, if there is no fecal drainage, no need to worry about that one. We can continue whatever care we. The nurse would know that dietary teaching had been effective for a client with colostomy when he states that he will eat. Options. A. Food low in fiber so that there is less stool. B. Everything he ate before the operation but will avoid those foods that cause gas. C. Bland foods so that his intestine do not become irritated. D. Soft foods that are more easily digested and absorbed by the large intestines. So these are the options for this question. Food low in fiber, everything he ate before the operation but will avoid those foods that cause gas, bland foods, soft foods. Answer B. Everything he ate before the operation but will avoid those foods that cause gas. There is no special diet for clients with colostomy. These clients can eat a regular diet. Only gas-forming foods that cause distension and discomfort should be avoided. Regarding the gas-forming foods also, we already discussed. So, you can avoid all this gas-forming and false odor foods. They should avoid it. Nursing Manthra study materials are available. So, if you know more details, you can contact me in WhatsApp. Question. A temporary colostomy is performed on the client with colon cancer. The nurse is aware that the proximal end of a double barrel colostomy. So, proximal end of the double barrel colostomy. A is the opening of the client's left side. B is the opening of the distal end of the client's left side, and C is the opening on the client's right side. D is the opening of the distal right side. These are the options. So C, answer is C. It is the opening on the client's right side. The proximal end of the double barrel colostomy is the end toward the small intestines. This end is on the client's right side. The distal end, as in answers A, B and D, is on the client's left side. So, the answer is C. It is the opening on the client's right side. Double barrel colostomy. Proximal end of a double barrel colostomy is in the right side. Question. Which of the following behavior of the client indicate the best initial step in learning to care for his colostomy? Options. A. Ask to defer colostomy care to another individual. B. Promises he will begin to listen the next day. C. Agrees to look at the colostomy. D. States that colostomy care is the function of the nurse while he is in the hospital. These are the options. As to defer colostomy care to another individual. B is promises he will begin to listen the next day. C agrees to look at the colostomy. D states that the colostomy care is the function of the nurse while he is in the hospital. Answer C. Agrees to look at the colostomy. The client made the best initial step in learning to care for his colostomy once he looks at the site. This is the start of the client's acceptance on his altered body image. A, B and D delays learning and shows the client's disinterest regarding the colostomy care. So, if the client agrees to look at the colostomy, that indicates the best initial step the client is willing to learn the care of his colostomy. Question. While irrigating the client's colostomy, patient suddenly complains of severe cramping. Initially, the nurse would. So, if the patient suddenly complains of severe cramping while irrigating the colostomy, what is the initial action for the nurse? Options. A. Stop the irrigation by clamping the tube. B. Slow down the irrigation. C. Tell the client that cramping will subside and is normal. D. Notify the physician. So, always for the blood transfusion or all these infusions, then irrigations, if there is abdominal cramp, what is the action? Answer is stop the irrigation by clamping the tube. Stopping the irrigation will also stop the cramping and pain. During the first few days of irrigation, client will feel pain and cramping as soon as the irrigant touches the bowl. This will start to lessen once the client got accustomed to colostomy irrigation. Slowing down the irrigation will not stop the pain. Telling the client that it is normal and will subside eventually is not acceptable when a client experiences pain. Pain is all-encompassing and always a priority over everything else in most situations. Notify the physician will not be helpful and unnecessary. That is unnecessary. So, we have to stop the irrigation. Thank you. So, if you need the Nursing Mantra study materials, you can contact in WhatsApp. It includes all the PROMETRIC questions from different authorities. Best of luck. Thank you.